Supposing it's the side of the neck that you are seeing over here. Okay. So the whole, now if you see one side of the neck over here, so the neck is divided by a muscle which is running from the sternum clavicle to the mastoid process. Yeah, it's called the sternocleidomastoid muscle. Okay, the sternocleidomastoid muscle, which is dividing the neck into two triangles. One which is anteriorly, which is called the anterior triangle. One which is posterior to it, which is called the posterior triangle. Okay. Now, there is also a muscle which is at the back. Here there is the front line, you see the hyoid bone and all the cartilage. You see all the tracheal rings and the cartilage and the thyroid cartilage, cricoid cartilage. ये आगे है, पीछे क्या है? There is another muscle which is running like this, which is called the trapezius. Okay. So this was sternocleidomastoid. If I shade it, and this one is the trapezius. Okay. Is it clear? So, which muscle is dividing the neck into two triangles? Sternocleidomastoid. Okay. The triangle behind is the posterior triangle. So, if we have to describe the boundary of the posterior triangle, which will be taught to you very soon. So, anteriorly you have sternocleidomastoid, posteriorly you have the trapezius, and the base is formed by the clavicle. Is it clear? Now, this anterior triangle is further divided by other muscles. Okay, there is one muscle which is running this is called the digastric muscle. This is the anterior belly of digastric, posterior belly of digastric. Okay, and there is one muscle which is going down, which is called the omohyoid. This again has two belly, and superior belly, inferior belly. Okay, so दो muscles यहाँ आ रहे हैं, एक तो digastric है, एक है omohyoid. Digastric के भी दो bellies हैं, anterior and posterior. Omohyoid has two bellies, superior and inferior. Okay, so this further is dividing. Now the anterior triangle is further divided into triangles. Like this is one triangle. This is called the digastric triangle. This is another triangle which is called the carotid triangle. This is the third triangle which is called the muscular triangle. Okay, इस तरह से triangle में एक और यहाँ पर triangle है which is called the mental triangle. So anterior triangle is divided into smaller triangles. I'm not going into that. That will be taught to you. Okay. What I'm trying to tell you is that in the neck, what are the things you actually find? Because before coming to the fascia, you need to know a few things about the neck. Okay. So in the neck, we have the side of the neck is divided by a muscle called the sternocleidomastoid into two triangles, anterior triangle and posterior triangle. The boundary of the posterior triangle is anteriorly by trapezius and base by the clavicle. Okay. What is the boundary of the anterior triangle? The anterior triangle boundary is anteriorly by the midline. अगर हम triangle की बात करें, anterior triangle की बात करें तो anteriorly by the midline, posteriorly by the sternocleidomastoid, and The base is by the mandible, like this, going up to the mastoid process. So this is the anterior triangle, which is further divided into other triangles. Anterior triangle is divided into 3.5 triangles. One is half, so whoever teaches you will teach you that. Okay. But what I am trying to tell you is when you go deep, you see the skin, then you see the platysma, and then you see what? You see the deep cervical fascia, which is actually the condensation of loose areolar tissue, okay, which is forming a lamellar sheath. Is that clear? But it's not very simple. It's not that you need to know the attachments. So this was a triangle, so I'll again draw a diagram where I can explain you. Okay, so you have over here the zygomatic arch. You have the external acoustic meatus. You have the styloid process. This is the mastoid process. There is the superior nuchal line. There is a external occipital protuberance, and there is the skull bone. Okay, and from over here you have the sternum. You have the clavicle. And you have a muscle which is running over here, which is the trapezius, and another one which is running over here, which is the sternocleidomastoid. And if I give an eye to, okay, so this is what you are seeing from here, okay. Now, the deep fascia or the deep cervical fascia has 3 layers, okay. Try to understand, don't write, it's all in your book. One is the anterior layer, which is all around the neck, okay. That is called the investing layer of deep cervical fascia. It's investing. The investing means उसे घेर रहा है, चारों तरफ से invest कर रहा है, surrounding it. Investing layer of deep. If I remove the skin and the superficial fascia and platysma, and if I put my hand like this, so this is the investing layer of deep cervical fascia. Okay, all around. Okay. Then you have this superficial, outermost, let's call it outermost. Then you have the middle layer, okay, which is around the trachea. I'll show you in the PPT also. That's called the pretracheal layer. It's surrounding the front and side of the trachea. What is it surrounding? The front and the side of the trachea. So it's called the pretracheal layer of deep cervical fascia. Okay. तो सबसे आगे हमको ट्रेकिया मिला था, सबसे पीछे क्या है तुम लोग बताओ? What do you have at the back? Vertebra. So it is another layer, modification of the deep cervical fascia, which is surrounding the vertebra. Okay. So that is called that's anterior to the vertebra. It's called the prevertebral layer. So superficial, middle and deep. सबसे superficial investing layer है. फिर बीच में है जो चारों तरफ नहीं है, बस ट्रेकिया के अराउंड है. That's called the pretracheal layer. Okay. And then deepest prevertebral layer. Okay, it's in front of the vertebra. Is it clear? Then there are also 2 other things that the deep cervical fascia is forming. One is the carotid sheath. Okay, the carotid sheath is a sheath around the internal carotid artery, common carotid and internal carotid artery, plus internal jugular vein and vagus nerve. We'll talk about that. Just forget a neurovascular sheath. What is a carotid sheath? A neurovascular sheath. Neuro means nerve, which is the 10th nerve, vagus nerve. Vascular means artery and vein. Artery is common carotid and internal, not external. Common carotid artery, internal carotid artery. And vein is internal jugular vein. इन तीनों स्ट्रक्चर के अराउंड एक शीथ बना रहा है, जिसको हम कहते हैं कैरोटिड शीथ. ये भी डीप सर्वाइकल फेशिया का पार्ट है. ठीक है? Is it clear? And there is also forming a sheath around the pharynx. and that is called the buccopharyngeal fascia. Buccopharyngeal fascia around the pharynx, so it is pharyngeal, and bucco because it's also covering the buccinator muscle. So buccopharyngeal fascia, it covers the buccinator and the constrictor muscles of pharynx. What does it cover, the buccopharyngeal fascia? अभी ये सब चीजें पढ़ाया नहीं गया है, बट हाँ बक्सिनेटर तो आपने पढ़ा है, तो बक्सिनेटर को के अराउंड एक फेशिया है बक्कोफेरिंजियल फेशिया, वही फेशिया जा रहा है अराउंड द मसल्स ऑफ द फेरिंग्स. फेरिंग्स जो बन रहा है ट्यूब, उसमें 3 कंस्ट्रिक्टर मसल्स होते हैं ना, इस तरह से. जैसे आप अगर एक कप के ऊपर दूसरा कप रखो, तीसरा कप रखो, है ना, एंड नाउ आई विल रिमूव द बेसेस ऑफ द कप, तो इस तरह से हो गया. So these are called constrictor muscles, superior constrictor muscle of pharynx, middle constrictor, inferior constrictor. Okay, that will be taught when pharynx is taught. So pharynx is made up of constrictor muscles and longitudinal muscles. There are longitudinal muscles also which are there. ठीक है, और इनके बाहर बाहर क्या है, you have the buccopharyngeal fascia. The buccopharyngeal fascia is outside the constrictor muscles and outside the buccinator also. The buccinator was here. So it's buccopharyngeal. So what are the things that found by the what are the 5 things found by the deep cervical fascia? Investing layer of deep cervical fascia, pretracheal, prevertebral. मेन यही 3 मेन है. ये 3 तो अच्छे से जानना है, लिखना है. उसके बाद चौथा है, थोड़ा कम इंपॉर्टेंट है, कैरोटिड शीट and buccopharyngeal fascia. So we divide it into 5 components. Okay, so let's first start with the investing layer of deep cervical fascia. Okay, the investing layer is a layer which is surrounding the neck all around. Is it clear? So it has some attachment above, some attachment below. Okay, some attachment anteriorly and some attachment posteriorly. How is that, Sanskar? So can I use my hand over you with your permission? So supposing is a investing layer of deep cervical fascia चारों तरफ है, तो ये ऊपर अटैच होगा ना, फिर नीचे कहीं पर अटैच होगा, आगे कहीं अटैच होगा और पीछे कहीं अटैच होगा. तो आपको चारों अटैचमेंट्स लिखने हैं इसके, where are it attached. Okay, now come. Superiorly, there is a protuberance over here in the occipital bone, external occipital protuberance. Then there are nuchal lines, superior, inferior nuchal lines. Been taught to you? So here it's attached to the superiorly to the external occipital protuberance. This is the external occipital protuberance, and this is supposing the nuchal line. So it's attached over here to these 2. Then to the mastoid process. Okay, is it clear? Then it is attached to the base of the bladder, of the mandible, base of the mandible. Is it base of the mandible? Okay. Once again, what are the attachments of a superior attachment of investing layer of deep cervical fascia? External occipital protuberance, superior nuchal line, mastoid process, base of the mandible. There is something I did not say was this area. यहाँ से यहाँ तक क्या हो रहा है? यहाँ पर एक parotid gland रहता है. Okay. Over here you have the parotid gland. So over here it will split and enclose the parotid gland. Okay. So it's coming like this, supposing external occipital protuberance, superior nuchal line, mastoid process, and over here you have the parotid gland, so it will split into 2 layers, superficial and deep. Okay. And then again it will join to form 1 layer, and then it will attach to the base of the mandible up to the mental protuberance. So this is a superior attachment. So you don't have to just cram it up. इसको समझ लो, बहुत simple है. ऐसा कोई रटने वाली चीज नहीं है, है ना? तो बताओ अपर अटैचमेंट कहाँ है? एक्सटर्नल ऑक्सीपिटल प्रोट्रूबरेंस, सुपीरियर न्यूकल लाइन, mastoid process, base of the mandible, up to the mental protuberance. Okay. Inferiorly, it is attached over here to the sternum, upper border of the manubrium sterni, clavicle, and then you have studied the scapula. So it goes behind to the spine of the scapula. Okay. तो ऐसे है, सिंपल है, manubrium sterni, clavicle, and then spine of scapula. यहां पर क्या था? एक्रोमियम प्रोसेस था, ये भी था, सॉरी. तो चार चीजें हैं, manubrium sterni, clavicle, एक्रोमियम प्रोसेस, स्पाइन ऑफ स्कैपुला. इज इट क्लियर? तो अभी का अभी याद कर लिया ना, इसमें कोई ऐसी चीज नहीं है कि, क्योंकि ये डीप सर्वाइकल फेशिया इज अ लॉन्ग क्वेश्चन और इट कैन बी अ शॉर्ट नोट ऑल्सो. ओके, सो सिट डाउन. थैंक यू. So upper attachment is to the external occipital protuberance, superior nuchal line, mastoid process, and the lower border of mandible, or lower border भी कह सकते हो, base of mandible, mental protuberance बोलो नहीं बोलो, base, lower border of mandible. Lower attachment is to the upper border of the sternum, manubrium sterni, superior border of the clavicle, acromion process, spine of scapula. Okay. Anteriorly, it's meeting with the other side. Sanskar, please, Raja. आगे जाके it's meeting with the other side. इधर वाला इधर से मीट कर रहा है, बट दो अटैचमेंट्स हैं इसके. Okay, one is the hyoid bone, and again below to the sternum, upper suprasternal notch. यहाँ पर suprasternal notch है, वहां पर है ना, और यहाँ मैंडिबल में तो अटैच था ही, बेंटाई, तो यहाँ पर अटैच है, बाकी एरिया में एक दूसरे से अटैच हो रहा है. Posteriorly, again it's meeting with each other, but it's attached to the 7th cervical vertebra. Okay, 7th cervical vertebra and ligamentum nuchae. I'll tell you what is ligamentum nuchae. Okay, to the 7th cervical vertebra and ligamentum nuchae. Okay. तो ये तो अटैचमेंट है, बट इसको हम लोग को ट्रेस करना पड़ता है कि ऊपर नीचे आगे पीछे हमने बता दिया, बट बाकी में भी ये फेशा बहुत सारी चीजें कर रही है. इट्स कॉल्ड द फेशा ऑफ 2. ये 2 + 2 + 2 + 2 + 2, 5 बार 2 है. क्या है? ये दो मसल्स को एनक्लोज कर रहा है, ये दो ग्लैंड को एनक्लोज कर रहा है. ठीक है, ये दो पुलीज बना रही हैं मसल्स के अराउंड. इज इट क्लियर? तो बहुत सारी टूल्स इसमें आते जाएंगी तुम्हारे पास. ये दो स्पेस को एनक्लोज कर रहा है. So I'll talk about that. I'll try to explain you. It's a fascia. Investing layer is called the fascia of 2 because it's a set of 2 + 2 + 2 + 2 + 2. ये 10 चीजें लिखनी है तुम्हें. ओके, तो अटैचमेंट याद हो गया आप लोग को. ओके, नाउ व्हाट हैपेंस इज, if you trace it upwards, there is a hyoid bone. यहां पर पूरा मान लो एक डीप सर्वाइकल, इन्वेस्टिंग लेयर ऑफ डीप सर्वाइकल फेशिया है. ओके, so when it goes up from the hyoid bone, above the hyoid bone, okay, there is a gland over here which is called the submandibular gland. It's a salivary gland just at the lower border of the mandible. Okay, so it will split to enclose the submandibular gland. ये split करेगा, और मान लो ये submandibular gland है, ऐसे होता नहीं है इस शेप का. तो ये जब फेशा आएगा यहाँ पर, तो ये स्प्लिट करेगा, इसको एंटीरियरली और पोस्टीरियरली कवर करेगा, फिर ज्वाइन कर जाएगा. ठीक है, इस तरह से. तो सिंगल लेयर है, दो में स्प्लिट करेगा, सुपरफिशियल एंड डीप, एंड देन अगेन ज्वाइन. इज इट क्लियर? Enclosing which gland? Submandibular gland. Then when it goes up, it again, I told you, it splits to enclose the parotid gland. Is it clear? So it will go and enclose the parotid gland. Okay? So let's go into this PPT and let me show you how it's happening. देखो, when the fascia, now I was telling you above the hyoid bone, please don't talk, above the hyoid bone, what is it doing? It's going up, splitting into superficial and deep layers. Okay? Now superficial layer is going, this is the superficial, this is the deep, by the way. Okay? Superficial layer is going and attaching to the, sorry, इसमें नहीं, इसमें बाद में आएंगे, let's come to this first. Hyoid bone, यहाँ गया, ये split किया into superficial and deep layer. Is it clear? Superficial layer is going and attaching to the base of the mandible. ऊपर से हमने कहा था ना base of mandible, तो यहाँ से भी जब जा रहा है तो यहाँ पर at the base of the mandible. Deep layer is going and attaching to the mandible. That is a mandible, तुम लोग पढ़ाया नहीं गया है, but mandible में इस तरह से अगर inner surface of mandible देखोगे, so there is a foramen over here, mandibular foramen, and there is a line. ये बाहर से नहीं, inner view दिखा रहे हैं. There is a line which is called the mylohyoid line. Okay? यहाँ से mylohyoid muscle arise करता है. तो दोनों mandible से mylohyoid muscle arise करेगा. Supposing mylohyoid line over here, and they come and they join in the midline, and they form the main floor जो बन रहा है ना, जो floor of the oral cavity, that's by the mylohyoid muscle. So where does it arise from? Mylohyoid line. The two mylohyoid muscle arise from the mylohyoid line. Okay? And this fascia is also going and attaching to the mylohyoid. यहाँ पे diagram में नहीं दिया है, it's not shown over here, but it's attaching to the mylohyoid line, the deep fascia part, and the superficial is attaching to the base of the mandible, enclosing the submandibular gland. Is it clear? Then behind the mandible, I told you again, it is splitting to enclosing a gland which is the parotid gland. Again dividing into superficial and deep. Superficial layer is going up and attaching to the zygomatic process. Superficial part is going up and attaching to the, this is the zygomatic process, so it will go and attach to the zygomatic process. And deep part will go and attach to a, हमने कुछ स्टूडेंट को टेम्पोरल बोन बताया था, पढ़ाया था, हाथ उठाओ. टेम्पोरल बोन, हाँ हाँ, हाथ नीचे मत करो. हमने बोन्स पढ़ाए थे किसे? स्कल के. हाँ, तुम थी ना? So what were the parts of the temporal bone? Who will tell me the parts of a temporal bone? Squamous, petromastoid, styloid process, and tympanic plate. Very good. Okay. So it is going and attaching to the tympanic plate and styloid process. ठीक है? ये जाकर के अटैच करता है कहाँ पर? Tympanic plate में और styloid process जो यहाँ पर नहीं दिखा रहा है, दो जगह of the temporal bone. Okay. So the deep cervical fascia, which was single layer, is splitting into two, superficial lamina and the deep lamina. Okay. Superficial lamina is thick. Okay. And it's also covering a muscle over here called the masseter muscle. Superficial lamina, यहाँ पर एक muscle है. Masseter muscle होता है यहाँ पर. The superficial lamina is covering both the parotid and the masseter muscle. So it's called the paratidomasseteric fascia. It forms the paratidomasseteric fascia. Is it clear? ठीक है, हम लोग का यहाँ पर एक masseter muscle होता है साइड में मैंडिबल के, masseter. You will study it later, okay? The superficial lamina, remember, is thick. It's attached to the zygomatic arch. It's going up and attaching to the zygomatic arch, and it's thick, and it's called the paratidomesenteric fascia. Is it clear? So superficial is thick, covering the parotid gland superficially, plus the masseter muscle. Hence, it's called the paratidomesenteric fascia. Deep lamina is thin. It covers the deep surface of the parotid gland. Nothing new, deep nami hai. And it attaches to the tympanic plate and mastoid process of the temporal bone. Styloid process, sorry. Tympanic plate and styloid process of the temporal bone. Is it clear? A part, which lamina is thick? Superficial. Which is thin? Deep. But a small part of the deep lamina thickens. Small part, जो यहाँ पर दिख रहा है, thickening. This is forming a ligament called the stylomandibular ligament. ये कौन सा ligament बनाता है? Stylomandibular ligament. और ये ligament separate करता है parotid gland को submandibular gland से, जो submandibular यहाँ पर है. तो इन दोनों को separate करता है ये ligament. So if there is an objective, which of the following ligaments separates the parotid from the submandibular? It's the stylomandibular ligament. Stylomandibular ligament is a modification of this, that, A, B, C, D. So it's a modification of, it's a modification of investing layers, pretracheal layers, prevertebral layers, so investing layers. है ना, वैसे भी पूछ सकता है और deep cervical भी पूछ सकता है. So you should know these questions. So the main thing is that it has split twice. Once it has split to enclose the submandibular gland. Okay? Superficial lamina was attaching to the base of the mandible. Deep lamina to the mylohyoid line. Again splitting to enclose the parotid gland. Superficial lamina thin, attached to the zygomatic arch. And it was not thin, thick, and attached to the zygomatic arch. It's also covering the masseter, so it's called the paratidomesenteric fascia. Deep lamina is thin, and it's attached to the tympanic plate and styloid process. Okay? Part of it thickens to form the stylomandibular ligament. Is it clear or not? Any doubt, any question? ठीक है, तो इस तरह से ये कर रहा है. Similarly, जब नीचे की तरफ आप ट्रेस करोगे ना, तो यहाँ पर आकर के ये स्प्लिट कर जाता है. सपोजिंग इस तरह से आकर के यहाँ पर ये स्प्लिट कर जाता है और यहाँ भी आकर के ये स्प्लिट कर जाता है क्लेविकल के ऊपर एंड स्टर्नम के ऊपर. एंड जो स्प्लिट करता है यहाँ कोई ग्लैंड नहीं है, इट्स जस्ट स्प्लिटिंग इनटू टू एट द लोअर पार्ट, जस्ट अबव द स्टर्नम एंड जस्ट अबव द क्लेविकल. These are spaces. These are called suprasternal space and supraclavicular space. Okay, so it's enclosing two spaces. One just above the sternum, okay, which is called suprasternal space or space of Berne, B-U-R-N. Okay, suprasternal space or space of Berne. Second is splitting just above the clavicle. Okay, and it's called the supraclavicular space. No other name to it. Okay. तो जब स्प्लिट करके यहाँ पर आएगा तो where will it attach? It will attach to the upper border of the sternum, anterior and posterior part of the upper border. Okay, and in the clavicle, it is coming and attaching to the upper border of the clavicle, supraclavicular space. अब एक बहुत इंटरेस्टिंग बात है, क्लेविकल के नीचे भी कुछ ऐसा था. ये क्या था? there was a Y which was there, that was the clavipectoral fascia. तो जिस तरह clavipectoral fascia स्प्लिट कर गया था और दोनों के बीच में कौन सा मसल था? सबक्लेवियस, है ना. तो यहाँ पर भी स्प्लिट कर गया है और यहाँ पर भी कुछ चीजें हैं, मसल्स नहीं है बट कुछ चीजें हैं. So what are the contents of the suprasternal space or space of Berne? One is a लिख लो, jugular venous. First, we are talking about the space of suprasternal space. Content क्या होगा? Jugular venous arch. I'll show you the diagram also if you have it. Then there is a nahi hai diagram, interclavicular ligament. There is a interclavicular, दोनों साइड के क्लैविकल लेफ्ट एंड राइट को ज्वाइन करता हुआ एक लिगामेंट है, वो सुप्रास्टर्नल स्पेस से क्रॉस करता है, ठीक है, इंटरक्लैविकुलर लिगामेंट. ओके, then what are the content of the supraclavicular space? The supraclavicular nerves and the external jugular vein. Supraclavicular nerve and the external jugular vein. There are some less important like lymph nodes. वो सब चलो है, देख लेना बुक से और एक्स्ट्रा, but main यही है, external jugular vein and the supraclavicular nerve. Okay, so these are the parts of the So you have to trace it, okay? Investing layer of the cervical fascia is the most important. You have to trace it. So when we trace it above the hyoid bone, it was going up, splitting to enclose submandibular, splitting to enclose the parotid. I won't tell the attachment. I've already told you many times. Okay? When going down below the hyoid, it's splitting to enclose the two spaces, supraclavicular and suprasternal space. Is it clear? And attachment हमने बता दिया था, superior attachment, inferior attachment, anterior attachment and posterior attachment. I told you there was a muscle over here. What muscle did I say? ये कौन सा मसल था? Very good, digastric. और एक मसल हमने बताया था यहाँ पर है, ये कौन सा था? ओमोहायोइड. तो ये जो दो बेलीज हैं, एंटीरियर एंड पोस्टीरियर बेली, है ना, तो इसके अराउंड एक ये डीप सर्वाइकल फेशिया एक स्लिंग बनाता है, और ओमोहायोइड के अराउंड भी एक स्लिंग बनाता है, ठीक है, जिससे कि they can move like it's almost acting like a pulley. Okay, so it's forming a sling, S-L-I-N-G, sling. So two slings are formed, one around the digastric, one for the digastric and one for the omohyoid. ठीक है, तो दो मसल्स को हाँ क्या कह रहा था मैं, दो ग्लैंड्स को एनक्लोज किया, दो स्पेसेस एनक्लोज किया, दो स्लिंग्स बनाए, है ना. Now when you trace what was the attachment anteriorly? Yeah, it was attaching with each other. It's attached to the mental protuberance, hyoid bone and the suprasternal part. Okay. And what was attaching posteriorly? ऊपर नहीं, external तो ऊपर वाला था. The C7 vertebra and ligamentum nuchae, है ना. तो अगर तुम पीछे देखो, ligamentum nuchae यहाँ दिखा रहा है. This is a ligament which is attaching. This is the spine of the seventh vertebra. This is ligamentum nuchae. Okay, this is ligamentum nuchae, and this is the spine of the. This is the vertebra. This is the spine of the vertebra. Ligamentum nuchae and spine. तो इससे attach हो रहा है. तो ये posterior to anterior when we move, the first thing you see is that it's again splitting to enclose a muscle and then join to form one, and again anteriorly it's splitting to enclose a muscle. It's nothing but the muscle that we have talked about. Yes. जब पीछे से शुरू हो रहा है, it is splitting. That's the horizontal section. It's splitting to enclose the trapezius. Okay. Then it goes like this through which triangle? Posterior triangle. So it forms the roof of the posterior triangle. ऊपर ऊपर जा रहा है, roof बना रहा है. Deep cervical, investing layer of deep cervical fascia. Then again splitting to enclose the sternocleidomastoid. Again uniting and again going to the midline anteriorly, forming the roof of the anterior triangle. Okay. So it's forming, it's enclosing which two muscles? Sternocleidomastoid and trapezius. पीछे से आ रहे हो तो trapezius and sternocleidomastoid. Forming roof of which two triangles? Anterior and posterior. तो कितने सारे twos हैं? है ना? So it's a fascia of two. Okay. तो बहुत अच्छे से लिखना है इसका अटैचमेंट, बुक से नोट भी बना लेना. अपर अटैचमेंट, लोअर अटैचमेंट, एंटीरियर, पोस्टीरियर. Then tracing of it above the hyoid bone, how it's going. You have to draw these two diagrams. Please do, when it comes, please draw both these diagrams. It's there in your book. Okay, how it's enclosing the submandibular. Superficial is attaching to the base of the mandible, deep to the mylohyoid line. Okay, how it's enclosing the parotid. Superficial is attached to the zygomatic arch. It is thick. It's called the paretidomesenteric fascia. Deep is thin. It is attached to the tympanic plate and styloid process. Okay, and a part of it thickens to form a gland, which is a ligament, which is called the stylomandibular ligament, which separates the parotid from the. Okay, this was the upper tracing. When we go down, it splits to enclose two spaces: suprasternal or space of burn, and supraclavicular. Supraclavicular में supraclavicular nerve है और external jugular vein है, ठीक है. और suprasternal में jugular venous arch है, interclavicular ligament है. Okay, so this is about the investing layer of deep cervical fascia. Now coming to the fascia which is doing less, इतना नहीं कर रहा है, that is pretracheal fascia. We'll talk about it. Just give me 2 minutes. Attendance होता है इन लोगों का यहाँ पर क्लास में, तो आप ले लीजिए, मैं सारा रेस्ट कर लेता हूँ. We actually had a New Year's celebration party yesterday, preponed it. So we had a party late night, so I was already quite not in the mood to take a class. So, तुम लोग तो साल भर पार्टी करते हो. Life is a party for you. जबरदस्ती भेजा गया जो बच्चों को है ना, स्कूल भेजते थे ना जब बच्चे रोते थे, उसी तरह तुम लोग यहाँ रोते बस नहीं हो, बट रिलक्टेंट हो आने के लिए.
रोल नंबर 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24.
I'm coming back. I'll take the class. Don't go away.
25.
अभी नहीं खत्म हुआ है, अभी तो मेरे
26
के बाद थोड़ा लेना है और ये पढ़ाएंगे. हाँ,
27
हो रहा है. आप बैठो आराम से.
28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50, 51, 52, 53, 54, 55, 56, 57, 58, 59, 60, 61, 62, 63, 64, 65, 66, 67, 68, 69, 70, 71, 72, 73, 74, 75, 76, 77, 78, 79, 80, 81, 82, 83, 84, 85, 86, 87, 88, 89, 90, 91, 92, 93, 94, 95, 96, 97, 98, 99, 100, 101, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, कौन है 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, बेटा जोर से बोले, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, दो की शक्ल एक जैसी है क्या?
क्या हुआ?
खड़ो, क्या रोल नंबर है? 130.
Don't smile. What's so funny? Keep standing. लो.
ये 55, 56 किसका था? अच्छा, ट्विंस हो क्या? एक जैसे लग रहे हैं.
बैठ जाओ.
बैठ जाओ. 31,
बहुत कंफ्यूजन करते हो तुम तो.
32, 33,
दोनों अच्छा करना, नहीं तो एक अच्छा करेगा, दूसरा खराब करेगा,
34,
दूसरे का मार्क्स इस पे चढ़ गया, फिर कोई और फेल हो गया, बहुत मुश्किल हो जाएगा.
36, 37,
How do I identify the two? What's your name?
38,
Darshini. And her?
39, 40, 41, 42, 43,
Don't talk.
44, 45, 46, 47.
इतना स्लो मत लीजिए मैडम.
Yes, sir. 48.
You are not well. Should I take?
नहीं सर, जस्ट हो गए
140.
150 पे आ गए सर.
हाँ?
150 पे आ गए सर. 150. प्रेजेंट 150, 51, 52, 53, 54, 55, 56, 57, 58, 59, 60, 61, 62, 63, 64, 65, 66, 67.
Please say
68.
yes. Don't raise your hand. Say yes. You can't look all around कि कौन हाथ उठा रहा है. Absent हो जाओगे फिर कहोगे सर मैं तो आता हूँ मेरा attendance short है.
70.
If you don't say yes, you will be marked absent and not her fault.
71, 72, 73.
Yes, that's the way.
74,
एक बच्चे में तो जान है कम से कम.
74, 75, 76, 77, 78, 79, 80, 81, 82, 82, 83, 84, 85, 86, 87, 88, 89, 200, oh sorry, 90,
ऐसे करके मत बोलो टीचर.
91,
ठीक है.
92,
Respect होना चाहिए चाहे कुछ भी हो.
93,
Not easy to take
94,
attendance of 250 people. When
95,
you become a teacher, you'll realize.
96,
Be patient.
97,
Don't show disrespect
98,
by ऐसे करके बात करना.
99, 200, 201, 2, 3, 4, 5, 6, 7, 8, 209, 10, 11, 12, 13,
Divya,
14, 15, 16, 17, 18, 19, 20,
हाँ क्यों नहीं?
21,
आज क्या है?
22,
नहीं.
23,
I'll leave
24,
you very soon. I'm not in the mood to even teach 1 hour.
25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50.
So coming to the second part, the pretracheal fascia. So what do you understand by pretracheal? क्या इससे तुमको मतलब समझ में आ रहा है? Pretracheal, anterior to the trachea. Okay. So just listen, don't write. Pretracheal fascia is the modification of the deep cervical fascia. Okay. तो हमने 3 पार्ट में डिवाइड किया था. सुपरफिशियल जो इन्वेस्टिंग लेयर था, मिडिल इज प्रीट्रेकियल एंड पोस्टीरियर इज प्रीवर्टिब्रल. सो इट्स अराउंड द फ्रंट एंड साइड ऑफ द ट्रेकिया. कहां पर रहता है? फ्रंट एंड साइड, नॉट बैक, फ्रंट एंड साइड ऑफ द ट्रेकिया. ओके, प्रीट्रेकियल fascia. Okay, the main function is to suspend the thyroid gland. You can see over here the that here it's suspending the thyroid gland. So it's enclosing only one gland. Okay, it's forming the capsule of the thyroid gland. Pretracheal fascia forms the thyroid gland has 2 capsules. Okay, one is the capsule that's formed by the thyroid gland itself, matlab connective tissue around the thyroid gland, they form a capsule. Okay, so that capsule is formed by the thyroid gland. So it's a true capsule, true, matlab belongs to the thyroid gland. And outside it, there is a false capsule, which is by the pretracheal fascia. So it forms the false capsule of the thyroid gland. So remember, when you will be taught thyroid gland, it's surrounded by two capsule. One is true, TRUE, another is false. True capsule is the inner one, which is the condensation of the connective tissue of the gland. ये और भी जगह ये पाया गया है, ट्रू एंड फॉल्स, और भी ऑर्गन में जब पढ़ोगे तब. ट्रू हमेशा उस ग्लैंड के टिश्यू से कंडेंसेशन से बनता है. फॉल्स इज बाय द डीप फेशिया. द प्रीट्रेकियल लेयर ऑफ द डीप फेशिया फॉर्म्स द false capsule of the thyroid gland. Okay, it's there because it's preventing the thyroid gland from sagging down, to fall down, hold कर रहा है ना? So what is the attachment of the pretracheal fascia? If you look very carefully, above it is attached to the thyroid bone. Okay, it's also attached to the thyroid cartilage. There is an oblique line in the thyroid cartilage, so it's attached to the oblique line of thyroid cartilage. बहुत important line है जब पढ़ोगे. So hyoid bone, oblique line of thyroid cartilage, and cricoid cartilage, arch of cricoid cartilage. इन तीनों से attach कर रहा है above. Okay, so it's attached above to the hyoid bone. You can see this line is the pretracheal layer. देखो pretracheal layer ये है. थायराइड बोन में गया, इससे भी अटैच हुआ ऑब्लिक लाइन ऑफ थायराइड कार्टिलेज. एंड यहाँ दिखा नहीं रहा है, ये लिगामेंट को मत देखो. दिस इज आल्सो अटैचिंग टू द cricoid cartilage, arch of the cricoid cartilage. Is it clear? Above. Below, if you look, it goes down and it attaches to the it goes into the thorax. neck से नीचे चला जा रहा है into the thorax. And it is attaching to the fibrous pericardium. Pericardium is the covering of the heart. तो उसके अराउंड जो कवरिंग है fibrous pericardium, उसमें नीचे thorax में जाके अटैच हो रहा है pretracheal fascia, inferiorly. From neck it is going to the, but before going there, it is enclosing a vein which is inferior thyroid vein. यहाँ show नहीं कर रहा है. It's enclosing a vein, inferior thyroid vein, and it is going behind the brachiocephalic vein. दो चीजें याद रखना, जब नीचे जा रहा है और फाइब्रस पेरिकार्डियम में अटैच हो रहा है, उसके पहले क्या क्या कर रहा है. अच्छा, इट्स एनक्लोजिंग अ इंफीरियर थायराइड वेन, इज गिवन इन योर बुक, एंड इट इज गोइंग बिहाइंड द ब्रेकियोसेफेलिक वेन. ठीक है, अगर याद रख सको तो अच्छी बात है. यहीं पर तुम लोग का नंबर पर है कि समवन विल गेट वेरी गुड मार्क्स एंड समवन विल गेट गुड मार्क्स. यू हैव टू राइट एवरी डिटेल, यू विल गेट 9 out of 10. 9 तो नहीं, 8 out of 10. If you write less, it is 7.5. Okay, so sometimes people say I have written everything and I haven't got. It's a very normal thing. हमको भी लगता था हमने तो सब लिखा है, but कुछ चीजें कुछ लोग एक्स्ट्रा लिखते हैं. So we never give 10 out of 10. We hardly give 9 out of 10. At least I don't. Very good, 8. 8.5. एकदम ही खुश कर दिए तो 9. तो सब कुछ अगर लिखोगे तब होगा. You get 9 or 8.5. So this is going, enclosing the inferior thyroid vein and going behind what? Brachiocephalic vein and attaching to the fibrous pericardium. Okay. The thyroid gland is like a, the thyroid gland is something like this. It's like a shield. It has two lateral lobe and an isthmus. Okay. So the lateral lobe of the thyroid gland, not cartilage, gland, इसका covering false capsule बना रहा है. Pretracheal fascia, true capsule and false capsule है. False capsule जो है, this is the lateral part is attached to the thyroid. The lateral lobe of the thyroid gland is attached to the cricoid cartilage by a ligament which is called ligament of Berry. What is ligament of Berry? This is formed by the pretracheal layer of deep cervical fascia. It connects the lateral lobe. इसीलिए हमने वो डायग्राम बनाया जो lateral वाला लोब है, ठीक है, to the cricoid cartilage. Okay, this is also preventing the thyroid from going down. ठीक है, बिल्कुल टंगा हुआ है दो ligament of Berry से. Is it clear? So pretracheal fascia के बारे में इतनी चीजें याद रखनी है. Superiorly it is attached to hyoid bone, oblique line of thyroid, and cricoid cartilage, arch of the cricoid cartilage. Inferiorly, it goes encloses the inferior thyroid vein, goes behind the brachiocephalic vein, and attaches to the fibrous pericardium. Okay, the lateral lobe of the thyroid gland is attached to the cricoid cartilage and sometimes also to the thyroid cartilage by ligament of Berry, which is again a modification of pretracheal layer. So this is about the pretracheal layer, less than investing layer. Finally coming to the prevertebral layer. So prevertebral layer, what do you understand by prevertebral layer? Anterior to the vertebra. Okay, it's lying anterior to the supposing there is a vertebra, okay, so there is a fascia which is lying anterior to the vertebra, okay, and just anterior to it you have the pharynx and the trachea, all these tubes, okay. So just anterior to the prevertebral fascia, what do you have? You have the pharynx surrounded by a fascia which is called the buccopharyngeal fascia. ठीक है? So not given the diagram, अच्छा इसने डाला नहीं है, डॉक्टर पुनीत भूल गए होंगे. So anyway, दो एक वर्टिब्रा का लेयर है, उसके आगे एक fascia है which is called the prevertebral fascia. Okay, and it's important to remember that all the cervical nerves which forms the brachial plexus also, they are coming from behind. Okay, they are going from behind the prevertebral fascia. So जब the cervical nerve which forms, what are the cervical nerves that form the brachial plexus? T5 to T1 है ना, जब बना रहा है, तो जब ये निकल रहा है तो ये प्रीवर्टिब्रल फेशिया जब इसके साथ एक शीथ देते जा रहा है, ठीक है, एक्सिलरी the subclavian artery and all, when they are going out, they are taking a sheath of the prevertebral fascia. तो एक्सिलरी शीथ जो जा रहा है तुम्हारा, जो एक्सिला में पढ़े थे, इट्स एक्चुअली अ पार्ट ऑफ द प्रीवर्टिब्रल fascia which has gone out. Okay, so prevertebral fascia also forms the axillary sheath. This is commonly asked. Okay, now what is the attachment of the prevertebral fascia? Above क्या attachment होगा? Above it is attached to the base of the skull. कहाँ पर attach होता है? Base of the skull. Okay, and below it goes down again into the thorax, and it divides into two lamina. Okay, so above it is attached to the, supposing this is the base of skull, so above it is attached to the base of skull, below it's dividing into two layers, anterior and posterior layers. Okay, anterior layer is called the alar part, and posterior layer has no separate name. So posterior layer of the below is attached to the end. ये थोड़ा सा paradoxical है या अलग. Posterior layer is attached to the anterior longitudinal ligament. ठीक है, anterior longitudinal ligament, and anterior layer is going and meeting with the buccopharyngeal fascia. ठीक है, क्योंकि इसके आगे buccopharyngeal fascia था. So देख लेना, इतना मेन है investing layer of the cervical fascia. इन दोनों का बस attachment देख लेना. The time is running out. I have to send you for the DH also. Okay, but remember prevertebral fascia का modification में axillary sheath आता है. ठीक है, upper attachment base of the skull, below is dividing into two layers, anterior and posterior layers. Okay, is it clear? एंटीरियर तो ए से है ही, पोस्टीरियर वाला जो है वो एंटीरियर लॉन्गिट्यूडनल लिगामेंट में जा रहा है, तो दोनों ही ए वाले हो जा रहे हैं. तो थैंक यू. वी आई ऑल्सो हैड टू टीच यू सर्वाइकल प्लेक्सस, बट आज नहीं हो पाया, मैं प्रैक्टिकल क्लास में पढ़ा दूंगा. सर्वाइकल प्लेक्सस भी आज होना था, बट एज ऑलवेज आई एम लेट टू फिनिश. प्लीज गो टू द DH. वन थिंग आई वांटेड टू टेल यू, whether you listen to me or not, matlab it's entirely you people are not a school going child anymore. Okay, so it's my duty as a teacher to keep telling you about what is good, what is right. Okay, but eventually the loss is yours if you don't listen to us. We don't expect us कि स्कूल टीचर की तरह हमेशा डांटे चिल्लाएं. आप लोग का अटेंडेंस इतना कम है, आज भी अगर देखें तो मुश्किल से 150 भी नहीं होंगे. इट्स नॉट टुडे, इट्स अ थिंग दैट्स गोइंग ऑन फॉर मंथ्स. You people don't give the exams, you don't come for the practical exam, you perform very, very poorly in your semester exams. Now let me tell you, you have seen the result of your senior. There are around 50 students who have failed and they were regular. जब इनके साथ ऐसा हो रहा है कि 50 स्टूडेंट्स फेल हो रहे हैं, तो आप बहुत ही चांसेस है कि आप लोग अगर नए साल से अपने को नहीं बदलते हैं तो आप लोग के साथ 100 से अबव फेलियर्स होंगे. ठीक है, आई एम टेलिंग यू एज अ वेल विशर, आई एम नॉट थ्रेटनिंग यू. And we also see ki who is coming and who is not coming. Don't think कि we are not noticing. We are making a list of things. अगर तुम नहीं आंसर करोगे, नहीं लिखोगे, तुम फेल कर जाओगे. बट अगर कहीं पर भी अगर मुझे लगा कि ये बच्चा रोज आता था, तो अगर मुझे हेल्प करना हुआ तो मैं उस बच्चे को ही हेल्प करूंगा जो रेगुलर मुझे दिख रहा है वाइवा में या प्रैक्टिकल में या किसी भी में, है ना. आप लोग नहीं आके बहुत ही ज्यादा गलत कर रहे हैं. बिकॉज अगर if you become serious from February or March, it will be too late. Let me tell you, if you are, it's already late. Upper limb is finished, lower limb is finished. Don't go by what your seniors say. Okay, you listen to your seniors. Seniors are very good people. I always say listen to the seniors who are good at studies. They are very, very good students in your seniors, in all the batches, to you people also, boys or girls. Don't listen to seniors who mislead you. अरे कुछ नहीं होता है, सब पास हो जाते हैं. नहीं, वो लोग नहीं हो रहे हैं, वो लोग अभी रो रहे हैं, रोज आ रहे हैं. सर कैसे होगा, रिटोटलिंग में नहीं होगा सर, तीनों में फेल हैं, 2 में हैं. तो वो सीनियर आपको नहीं आएंगे उस समय आपके आंसू पोंछने, है ना. एंड एक बार धब्बा लग जाएगा ना कि तुमको सप्ली लग गया, तो तुम्हारा कॉन्फिडेंस, कुछ होगा नहीं, तुम लोग फिर भी पास करके डॉक्टर बन जाओगे, पर तुम्हारा कॉन्फिडेंस लो हो जाएगा. फर्स्ट ईयर में ऐसा होगा. So I am just telling you, please be very, very serious. Head and neck is the most important part, and abdomen and pelvis. Upper lower limb को तुम लोग easy मानते हैं, उसमें तुम लोग नहीं पास कर पा रहे हो. Head and neck is very tough and very, very important part. So please be very serious. I have seen a lot of people who are very serious in the DH जब पढ़ाया जा रहा है. I think most of you who are coming are the serious ones. तो जिन्हें मैं मुझे बोलना है वो तो यहाँ है नहीं. But I'll write a note in that group that I have formed. Because I think it's time that you become serious, otherwise you will regret. And I don't wish bad for anyone. क्योंकि तुम्हारे पेरेंट्स से जब बात करते हैं, they are such wonderful people, इतना मेहनत, they are not aware कि आपके बच्चे नहीं आ रहे. They get into a kind of shock. अच्छा नहीं आता है, नहीं आता. इसीलिए जब हम फादर से बात करने की बात करते हैं, सबका फेस उतर जाता है. सर वन लास्ट चांस एंड ऑल करने लगते हैं. पेरेंट्स को आप लोग धोखा दे रहे हो, मुझे नहीं दे रहे हो, खुद को दे रहे हो, पेरेंट्स को दे रहे हो. एंड please don't do that. It's very sad. There are so many students who are so good they don't get a chance to come to medical college. God has given you this wonderful opportunity and they have given you one of the best colleges. You can't find a better college जहाँ पर हमने डाला था ना किस तरह की किस लेवल के ऑपरेशन हो रहे हैं, हार्ट ट्रांसप्लांट हो रहा है, मतलब आप उस कॉलेज में पढ़ रहे हो और आप अच्छी चीजें नहीं सीख रहे हो. आपको जब लाया जाता है जेनेटिक्स के क्लास में, इट्स नॉट माई ड्यूटी कि आपको मैं बोलूं चुप होने के लिए. आपको कुछ नहीं समझ में आ रहा है, मैं समझ रहा हूँ, मुझे भी बहुत चीजें नहीं आ रही थी, जेनेटिक्स का हाई लेवल था. यू कैन लर्न फ्रॉम दीज पीपल कि हाउ उनमें एक नॉलेज झलकता है जब वो बोल रही थी, दोज लेडीज एज वे शी वाज स्पीकिंग. ट्राई टू बी लाइक दैट पर्सन. जितना भी समझ पा रहे हो 1%, 5%, ट्राई टू इमुलेट कि मुंबई टीएमएच बेस्ट प्लेस के डॉक्टर आए हुए हैं, आपको एक लेक्चर देते हैं, किस तरह बोल रहे हैं, सीखो कि हम भी इस तरह प्रेजेंट करेंगे, हम भी इस तरह से बोलेंगे. अपने में वो चीज लाओ रेदर देन कि बस एब्सेंट होना, गायब होना, मजाक करना, एंड पूरा तुम लोग अपने करियर के साथ खिलवाड़ कर रहे हो. So it's very sad. Don't do that. And I hope New Year may you take this resolution and all of you become very serious. इतना खुशी होता है जब हम सुनते हैं हमारे स्टूडेंट्स पीजी में अच्छा कर रहे हैं या कहीं पर बहुत, मैं 20 साल से पढ़ा रहा हूँ, तो कुछ बहुत अच्छे डॉक्टर्स बन गए, नर्सिंग होम है, क्लिनिक है, तो फील गुड अबाउट इट, है ना. अब बहुत बुरा लगता है कि नहीं वो कुछ नहीं कर रहा है, बस बैठा हुआ है ऐसे ही. 40-50 हज़ार की नौकरी के लिए तुम इतने करोड़ रुपए क्यों खर्च कर रहे हो? अच्छा तो इन्वेस्ट कर देते हैं ना. So please try to, and there's so much potential in you people कि you don't realize. एक एक बच्चे में चाहे वो 0 ला रहा हो या वो टॉप कर रहा हो, सब में पोटेंशियल है. You have to take that out. सोए रहोगे तो नहीं होगा. ठीक है, ओके. Go to the